And joining me right now is Dr. Deborah Hardy Cartwright out of Annapolis. Good morning. Thank you for joining us.
Good morning.
I wanted you
My
on
pleasure.
because I love your expertise. And I think that people in the community need to hear from a doctor. You've been doing it there 30 plus years in Annapolis, and you've read up on this vaccine. What are your initial thoughts of the shot?
Well, I've received the second dose myself, and when I got the initial dose, I was quite emotional because I was thinking, finally, we're getting somewhere with this vaccine. And I feel like if we want to get to some level of normalcy, then we need to somehow obtain herd immunity so we can get on with our lives.
I've spoken to people in the family, friends, and people in the community, and I do notice that, it's a lot of folks in the minority communities who are hesitant to do this. And I'm curious, when you talk to patients, what are reasons that they say to you of why they may be hesitant to get the shot?
Yeah, I have noticed that to be true in my patient population as well. And there is definitely a level of hesitancy, especially in the Black population. I actually have had more of my patients that want to get the vaccine that haven't been able to get it yet because of the hierarchy and the availability. But I do notice that there are some level of hesitancy that I was actually surprised about because, as we know, the mortality rate in the Black population is about three times more than the white population. So it makes more sense that we would be jumping at the chance to have a vaccine that would help us. And also, out of the millions of vaccines that have been distributed now and given, there have been minimal to no side effects, and no one has died from the vaccine.
Sure.
And we know the thousands of numbers that have died from COVID. And to me, the numbers speak for themselves, as far as the benefit of the vaccine. And then with the health disparities, I do understand the hesitancy in the Black population because historically, we have been mistreated, and a lot of them say, well, what about Tuskegee and the Henrietta Lacks situation? And I pretty much say that this is a different day. We have regulations now that the FDA even has experts and researchers that are Black. They have regulations now that forbid studies like the blind study they had with Tuskegee, because they were actually misleading those patients. They were
Sure.
making them believe they were being treated and they weren't. So this is totally different. We're not denying treatment for a disease, knowing that that's going to be detrimental to the population.
Going to the doctors was, we had to be pushed a little bit to go. So does it
Yes.
make your job a little bit harder to get that face-to-face time with folks when you're still trying to convince them to come through the front door?
Yeah, it does. And I think that a lot of our Black population do feel more comfortable with a Black physician, for instance, because they feel like they can identify.
Sure.
But I think that there is a considerable level of, I would say, implicit bias and systemic racism
Sure.
that has to be overcome. And it has been even brought more to the forefront now because of the political climate and what we've been through. So I think that's made it harder too for our population to accept the vaccine
Sure.
because there has been historically bias and now it's just been brought to the forefront. So there's a lack of trust.
Yeah.
And I do understand that. And that's why I like to talk to my patients. I like to find out, why do you have this distrust, and to try to fix that. And it's going to be a long time before we fix the basic cause of all of this hesitancy. Absolutely.
Give me the
Yeah.
pitch from a medical professional if you want people to go and get this vaccine.
There have been tests done since March of 2020. So you're not the first one. The people that signed up to participate in the trials were the first ones. So we all, and this has been almost a year. So we already have evidence that it hasn't killed the people that have taken the vaccine. but every day we see a rise in numbers.
Sure.
And if you want to go to church, if you want to go to, have family reunions, you want to go to a wedding, you want to sit at dinner with your you want to hug your grandma, this is what you got to do. You got to get the vaccine to protect them. That's what it's all about. We're not going to get anywhere. We're not going to get anywhere close to normalcy unless we all play our role and get this vaccine.
For the greater good, Dr. Deborah Hardy Cartwright, thank you for your time. I appreciate it.
Well, thanks for having me on. I appreciate that.
Certainly.